What happened in Wisconsin was no accident. We have just learned a pharmacist was arrested today for intentionally removing vials of Moderna's vaccine from a fridge. We don't know why he did it, but it ruined 500 doses. That's according to the Advocate Aurora Health System. The company fired the Milwaukee area employee. The FBI is investigating. Aurora rushed to give 57 doses before the post-refrigeration window expired. But the company's president said today they shouldn't have done that because those doses were actually out longer than originally thought.
This means that the 57 vaccinations that were administered on December 26th were rendered less effective or ineffective. The 57 recipients of those vaccines have been notified. At this time, there is no evidence that the vaccinations pose any harm to them.
Dr. Robert Citrenberg is the Executive Medical Director of Infectious Disease and Prevention at Advocate Aurora Healthcare, and I'm glad that you are joining us tonight. The people that received that Moderna vaccine, we heard the president of your hospital there say there's no indication they're in danger. Do you have any concerns that they got those shots that had been left out?
Well, good evening. We don't have any concerns about safety. We've been in communication with Moderna throughout the day. We're not concerned about any safety issues, but we are concerned about these people possibly receiving a vaccine that was left out and therefore inactivated or degraded. So we are in communication with Moderna and FDA and trying to figure out the best strategy going forward for these 57 people.
Look, you're dealing with truly an unanticipated challenge in this pharmacist allegedly intentionally ruining doses. There are hospital administrators and doctors across the nation that are dealing with unanticipated challenges with this vaccine rollout. What's your crucial priority right now? What's the biggest challenge?
We have to vaccinate as many people as we can. We're in a race against COVID right now. The purpose of mass vaccination is to protect the population from getting the disease. But now we have explosive rates of disease throughout the country. So it's a real race. We must do better. You know, it's a blessing that we even have vaccine before the new year. But now that we have it, we have to do a much better job getting it out to people, particularly those at risk, elderly, and those with chronic medical problems.
Dr. Citrenberg, how many doses of the vaccine does your system have on hand?
We have a limited supply right now because we've used almost all of it. So in just under 2 weeks, we have vaccinated 25,000 of our team members in Illinois and Wisconsin. It's been a monumental effort to get that done. We are expecting more vaccine to come in next week, both the Pfizer and Moderna vaccines coming in, but we're using them up as soon as we get them.
Okay, so I'm having trouble understanding how nationwide you can have so many more millions of doses of the shots delivered, but not delivered into arms. Where's the logjam?
It's unclear. You know, there's so many layers of the distribution from the federal government to the states to the counties and all the local government. There's so many layers that the vaccine can be delayed at any one of those points. So as soon as we get the vaccine, we're using it. I don't know that all healthcare systems are able to do the same, particularly in rural areas where they may not have the capabilities to do that. So the system is very complicated. I think going forward, that needs to get better also. It needs to be much more simple in order to be able to provide these mass vaccinations.
The president-elect has said 100 million doses in his first 100 days in office. Okay, so we'll see how he's going to try to manage that. In the meantime, we're dealing with these skyrocketing infection rates. What's your expectation for January?
We're concerned. Here in the Midwest, fortunately, we were spared by the post-Thanksgiving surge, but we're not at all confident that we'll be spared by the post-Christmas surge. We now see the contagious strains of virus circulating, record numbers of people traveling and congregating. It's really the perfect storm right now for disaster. And you can see what's happened in Southern California, which has just been decimated by this virus over the past few weeks. And there's no reason to believe that any part of the country, including where we live, will be spared. So we're nervous about what's going to happen in the next few weeks.